All right, so you're an injector and you've been doing toxin fillers in your practice. You're thinking about diving into the skin realm. What's the best way of getting into the skin realm? Get microneedling in your practice. So that's what this video is going to be about today, how to incorporate microneedling into your practice, basics of microneedling, and how you can learn this awesome addition to an aesthetic practice. So what is microneedling? Microneedling is a process where we physically damage the skin to get rejuvenation. And before we dive into how that works, it's a really simple process in the office. There's devices out there. There's a litany of different devices you can buy to do this, but they kind of look like a tattoo needler, right? The devices have a needle that you can program at various steps. In certain parts of the face, you go deeper. In certain parts, you go lighter. And by causing that damage, we initiate the wound healing cascade. And the wound healing cascade does wonderful things for rejuvenation. So what does that wound healing cascade look like? We cause some damage. Immediately, we're going to start the inflammatory process. That inflammatory process takes minutes to hours to start going. Okay, so the inflammatory process involves platelets coming to the area, sending out signals, wound, heal, and then what happens? The body responds through the healing cascade. After an inflammatory process, stem cell migration goes in. This all happens within hours after the treatment. Stem cells will go into the area and they'll start differentiating. What do they differentiate into? Fibroblasts. We call that cell morphing. So we're morphing those stem cells into fibroblasts. Fibroblast proliferation starts around day 7. All right. What do fibroblasts do? Make and remodel collagen. Okay. At the age of 25, we start losing collagen faster than we can make it. This is why as we age, our skin gets wrinkly, lax, thin, because we just can't keep up with it. What does microneedling do? Starts the rejuvenation process, brings more fibroblasts in, creates more collagen, more elastin, makes the skin more youthful. So now we've got fibroblast proliferation. What happens after fibroblast proliferation? Collagen proliferation. Collagen will really start to build around day 21. Okay? And from day 21 to day 40 after the treatments where you really get that remodeling and restructuring of the collagen. All right. What do we typically do at day 30? Hit them again. Like if they're really trying to bring the age back, hit them again at day 30, maybe at day 60, every 30 days until you start to see a reversal of that aging process. And then we maintain with the treatment every 3 to 6 months after that, okay? But that's the healing cascade. The treatment you do today, you're not gonna see benefits for weeks to months later, right? Because we gotta let the body do its natural thing. So that's what microneedling does. What's another nice thing about microneedling? The skin's really good at keeping stuff out, right? Keeps bacteria out, keeps things in, it keeps moisture in your body, it keeps all the nasty dirt and everything outside of your body. But when you poke a hole in it, you have a rare opportunity to introduce something into the skin. And what do we like to introduce in the skin? Growth factors. We can put in hyaluronic acid serums, we can do platelets, we can do PRF. One of my favorite things to do is an exosome. Exosomes are stem cell derived growth factors that you can buy. You rub that on the face, it's like fertilizing the garden. So we just aerated the lawn and now we have all these little holes in the lawn. What do? We put stuff in there. The skin literally soaks up. You got about 23 hours to let that stuff just really soak in. And then it clots off and then the healing cascade happens. So we can really help the body heal by adding the right nutrients and things into the skin right after the microneedling treatment. In my practice, we charge anywhere from $250 to $400 per zone for microneedling. Great adjunct to the practice. If you don't have it, you should bring it in. It's not that expensive to get into. Most devices cost at most $5,000. We're looking at about $20 to $30 of disposables for each patient. And you can do the math on that. If you're making $200 to $300 per patient per visit, you're doing well. The last thing I love about microneedling, you have an opportunity to sell them after products. Here's a post-healing product, okay? Maybe we have a mask, maybe we have some serums, maybe we have some lotions. Hey, you're gonna need sunscreen to protect your skin. We gotta avoid the sun for 2 weeks. So hey, here's a really good sunscreen that I can sell you. Hey, let me add on an additional service. Let's add on some exosomes or do a vampire facial, right? Great way of bringing in a little extra revenue into your practice. And they'll keep coming back and they're going to love the way they look. They're going to love the glow. They're going to love the rejuvenation. My patients that have been doing microneedling for years and years and years do not age. It goes backwards. It's the most wonderful thing ever. So if you're not doing microneedling, get into it. It's a great adjunct to any injectable practice. You can do this in somebody's home. You can do this in your own practice. Easy, easy, easy to do. So hope you learned a few things about microneedling. If you're not doing it, you should be.